Hyperthyroidism is a very common endocrine disease of senior cats, but it is very rare in dogs. The enlarged thyroid gland, usually caused by a benign thyroid tumor, releases increased amounts of thyroid hormone that causes symptoms varying in severity depending on how long a cat has been ill with the disease. Once this was thought to be only a disease of very geriatric cats, but more and more in our practice we're seeing hyperthyroidism in senior cats who are 8, 9, or 10 years of age. The common symptoms of the disease include weight loss and muscle loss, and this is something that the clients normally pick up on because it's usually very rapid and quite significant. The cats can have a tremendously increased appetite that can just be ravenous. Sometimes they will have vomiting or diarrhea as the disease progresses. Once they have it, then they do eventually get sick with hyperthyroidism. Many cats will have increased thirst, and some of them will have a poor skin and coat condition that you would just associate with any cat that has a chronic disease. Some of the cats are hyperactive, and this is a very common trait of humans who have hyperthyroidism. So, if your cat's bouncing off the walls and is losing weight and muscle loss, that would certainly be something to bring to the attention of your veterinarian. So when a cat is suspected of being hyperthyroid, a complete blood panel is performed to ensure that other diseases like diabetes or kidney failure aren't present. If hyperthyroidism is left untreated, the disease can have serious, sometimes fatal consequences, especially on organs like the heart and the kidneys. Fortunately today, we have several possible treatments for this geriatric disease that can result often in a cure or at least in long-term control. There are 4 options for managing hyperthyroidism. 3 of them have been available for many years, and 1 treatment is brand new. The first tried and true method is an injection of radioactive iodine that destroys thyroid tumor tissue, and this is also a common treatment of humans with hyperthyroidism as well. This is the one treatment that results in a cure of the disease 99% of the time. It is the most costly therapy, but it is considered the gold standard treatment. After the injection, though, cats must stay in the veterinary facility for 3 to 5 days to allow most of the radioactivity to dissipate from the body before they can go home. The second long-standing treatment that is available is giving your cat daily medication with an anti-thyroid medication that can be given as an oral pill or applied to the ear tip in a compounded transdermal gel in a little applicator like this. You just dial it up and you smear the medication on the hairless side of the ear tip of the cat, and it's absorbed right into the body. Most cats can use this medication. It's absorbed well and gives you good blood levels of the medication. Now, because hyperthyroid cats are often very elderly, some clients choose these pay-as-you-go options rather than paying the upfront costs of a radioactive iodine injection. And that's always an option. Now, the third option, which is a very old treatment for this disease, is surgery to actually remove the diseased thyroid gland. Now, this has really fallen out of favor because we've learned through experience that sometimes these cats have a second very small thyroid nodule that you don't detect at the time of surgery, so you remove the one thyroid gland and then months later they're hyperthyroid again. So we don't recommend this treatment anymore. So let's talk about the brand new treatment just available this month. This involves daily nutrition with a special cat food that limits dietary iodine intake. This reduces thyroid hormone production, thereby controlling the disease. This prescription food from the Hills Company is called YD. Because this iodine-restricted diet must be fed exclusively, this treatment may be ineffective in multiple cat households where other regular cat foods are fed. It would only take a teaspoon of stolen cat food or a few treats every day to ruin thyroid control by this method. Cats who go outside and hunt and eat their prey would also not be candidates for this nutritional treatment. In households where diet can be controlled, this nutritional approach to the long-term control of hyperthyroidism has proven to be effective in extensive clinical trials. This new food will be available this month at our veterinary facility, and our medical staff will be able to explain the entire program of transitioning onto the YD food and weaning off anti-thyroid medications. This discussion of hyperthyroidism in cats has been another health tip from the staff of Pittsburgh Spay Vaccination Clinic, a full-service veterinary facility.